Hi, I'm Cliff. I'm a functional medicine physician assistant here at Risen Wellness, and I'm hoping to make a few videos that will help outline what functional medicine is, what our approach here at Risen Wellness is, and how we work together with our patients to help reach true human flourishing. Functional medicine, holistic medicine, conventional medicine, what do these words even mean, right? They can be so confusing. So I want to break down a little bit what functional medicine actually is. So when patients come to see us here at Risen Wellness, we're a nonprofit functional medicine clinic. And so sometimes they're confused by what exactly is functional medicine. So I want to give a short explanation. And we can do that by looking at a tree. So just as a tree has roots, and from those roots, they're able to absorb nutrients, absorb water that goes up into the tree and helps to facilitate the health of the tree. Well, in a very similar way, we have these roots of the functional medicine tree, which are what we call lifestyle factors. And so that's sleep and relaxation, exercise and movement, nutrition, the stress that we have in our life and how we manage that stress, and then a look at relationships and community. All of these are vital to helping us have a healthy life. Now, of course, those are not the be-all, end-all of health. They are certainly foundational and they're very important for everything we do. But we also want to look at a little higher up in the tree, and that's looking at the bottom of the trunk here. We can see things that we call antecedents. These are things that happened before we recognize the symptoms that we have. So that's going to be like, what environment did we grow up in? What genetic predispositions do we have? Is there certain disease processes or symptoms that have sort of been in our family for a long time? So if they are, then we need to take a look at those and discuss them. We also look at triggers and mediators. So these are things that could have either triggered the symptom or they could be perpetuating the symptom because these mediators are continuing, because the activity is continuing, then the symptoms continue. So we look for those. We look at 7 different clinical imbalances. We organize the body, we organize the being into 7 systems. And so by looking at those 7 systems, we're looking for an imbalance. And we're trying to bring the body into balance with the created order, which is what is so exciting. I mean, this is talking about living as we have been created to live, to flourish within nature, within our creation, within our environment. When we are not flourishing, then that's where we look at the leaves of the tree. These are our symptoms, whether they be cardiology symptoms. These can be things that have to do with our heart, or with our blood vessels, or maybe it's pulmonary, maybe it's a breathing issue, urinary issues, maybe it's a neurological issue or an immune issue. All of those are symptoms that help us dig down deeper into the tree to try and look for the imbalance. So that's a very brief, broad overview of what functional medicine is. But I think it's important that as we start this journey together on uncovering what your root causes are, that you have at least an idea of how this works. Now, I hope to make other videos that are going to go into each of these a little deeper so you can continue to improve our understanding of what helps us to flourish and grow as we've been created.